All right, hello everybody.
Hi.
So glad to be here with Amber. What is your official title, Amber?
So I'm a family nurse practitioner, but people just call me Amber. Amber Lambert. My name rhymes. It's easy to remember.
That is nice. So glad again to have you here, and we're gonna jump right in with some questions. We want to get to know you a little bit, and then of course you're also gonna talk about marijuana and fertility, which I know is a hot topic right now. So I'm so excited to learn more. So why don't you tell us a little bit about yourself?
So I live in Louisiana. I have a family nurse practitioner degree. I got it from Louisiana State University right here in New Orleans. I'm currently pursuing my doctorate degree, set to graduate December of 2021 if all these hurricanes and pandemics don't delay anything. So we're getting ready to have another hurricane here. So right now I was just saying the weather is beautiful, but in a few days it might be a completely different story. But I've been working with women for a little over 10 years now.
Oh, awesome. And why did you choose to work with Prima?
So I really like this app. I feel like the app and Premom gives women the opportunity to learn about their cycles and to track your cycles over time and looking at your peak and when you ovulate and the best time to have intercourse. The other thing, the component that it had in there was tracking your cervical mucus, so you can be familiar with when you are ovulating and the changes and the hormonal changes that take place with the mucus after, and to be able to identify those things. The other thing is it gives you the opportunity to try to figure things out without having to go to a fertility clinic, which, sometimes can be scary for some people. And the other thing, it could be very costly. And then you have virtual consults that are available where you can talk to somebody that's had the ability or have had experience with natural family planning or just family planning in general without having to go into to women and trying to get pregnant in knowledge. And the app also has a whole lot of education for these women to kind of go on there and look at it and say, okay, what does this mean? Or what can I do with this? So I really liked it. I felt like it has a whole lot of aspects in there that are good for women, especially women trying to get pregnant.
Yeah, I know you've had some consultations already and it sounded like they were going well.
Absolutely.
Excellent. And then can you talk a little bit more about what you specialize in and who you like working with in particular?
So predominantly women's health. So over the last 10 years, I would say pretty much the whole 10 years has always been some type of women's health clinic. I don't work in the hospital. I'm not a midwife, so I don't deliver babies, but women's health. My love, or is like a soft spot for me, is preventing teen pregnancy, I should say. Teen pregnancy prevention, birth control, and helping teens learn about their bodies and their cycles and what's normal and what's not normal, because there's so many changes that take place as a teenager, and especially even women finding, and what do I do when it's not, kind of thing. So it's kind of one of my specialty areas there.
That's fantastic. I think that's so needed.
Oh yes, I love that, because Louisiana at one point we were the highest unintended teen pregnancy rate or unintended pregnancy rate for a very long time. So it's one of those things that I really like to be involved in.
Yeah, I know for me, just personally, there was a lot that I didn't know about my body until I started in this job. So I'm like, it'd be great if we could catch people when they are starting to go through these changes and need to already start tracking their fertility.
Right, because it can be scary, especially for young adults. It can be scary. There's so many things, like we talked about, something simple as cervical mucus. What's normal? What's not normal? It can be scary when things like that you see as like a 13, 14-year-old and you've never seen something like that before. So letting them know that these are normal.
Yeah. I lost you a little bit. So you're talking about how it's good to let them know that these things are normal. I missed the rest of that.
Absolutely. So, and that not to be scared of those changes, and then to ask questions when you need to.
Okay, good. All right. I would love to talk to you more about that sometime. Let's jump into our topic for today.
Absolutely.
We had a lot of questions, so we condensed them down a bit, right? Here's your first question. Can I still get pregnant, guessing when on marijuana, and how does it affect women's fertility? How would it affect her fertility?
So I'll tell you, this topic I get asked all the time. So that's why I thought it was a very important topic, especially now because we're having more legalization of marijuana. So you get these questions all the time. So one thing that we say, in a short, easy answer to that is, can I get pregnant if I smoke marijuana? Is yes, you can. People get pregnant who smoke marijuana all the time. The question that comes to be is like, does it affect your ovulation? So there's some data, or there's some studies that says, yes, potentially it can delay your ovulation. But then when you look at databases on pregnancy or prolonged and timing to get pregnant, there's nothing that really supports that as much. So kind of digging deep into the research and the information is that when you see these delays of pregnancy of people who smoke marijuana, there's generally other additive things that are going on that can contribute to delay of ovulation or delay of getting pregnant. Sometimes obesity or diabetes, insulin resistance, all those things, and add marijuana to that potentially can delay an ovulation. So somebody may not have a period every 28 days. They might have a period every 35 or 45 days. And that can delay or prolong getting pregnant. But that doesn't mean necessarily that you cannot get pregnant just because you smoke marijuana. Does that make sense?
Yeah, that's interesting. So is it acceptable to have marijuana when you are pregnant?
Okay, so I get that question a lot too. So I think the huge thing with this is the unknown, and mainly because there's not a whole lot of studies that we have or controlled studies on pregnancy. So this is how I usually explain it: is you have two groups, okay? 20 people here that are pregnant and 20 people here that are pregnant. Everybody's the same kind of people here. But we can't do studies where we say this group is going to get marijuana, cocaine, and ecstasy, and this group isn't going to have anything, and let's just see how everything turns out. So it's not ethical, it's not moral. We can't do studies like this. So that's why it's hard to have studies to see what are these effects, because you have to do observation over time, over long periods of time, and not just of the pregnancy and the growth of the pregnancy, but also what happens to offspring and these babies later on. So that's why it takes a long time to get this information. But what we do know is it does cross the placenta. It is entered in breast milk. So you see these things. And because there's so much unknown, we do not recommend marijuana in pregnancy. With that being said, we have found that there are potential for what we call neurodevelopment problems. And there is evidence that shows that. So meaning when I say that, we have seen later on as studies have progressed and looked at these children over time, some of these children have lower cognition or decrease in academic achievements or lower IQs, increased risk of like hyperactivity or attention deficit, ADD kind of thing. So it has shown those things. The other thing is it talks about potential, fetal growth restriction during a pregnancy, but also usually those things are also affected with other comorbidities or risk factors that are going on during that pregnancy too, like smoking tobacco or blood pressure problems during the pregnancy. So those are all things combined. So because there's so much lack of data there, and there is a need for more research, because we don't know all the specifics of the risk, but we do know that there is some cognition and problems later on in life with the children, we don't recommend any at all.
Okay.
Does that make sense?
Yeah, that makes sense. I'm wondering if that ties into another question, or if this is more for men. Like, does high or low amount have a difference? You're saying for pregnancy, don't do it to be safe, but then for like when you're trying to conceive, is there an amount that's safe, or is it the same thing?
Same thing. So we don't say, especially with women, we don't have any dose specific to say yay or nay to, but there's more data out there that's showing that it has more risk factors, or there's potential for more long-term risk factors in the offspring later on. So I would say dose, we still say no, nothing, that we don't recommend anything at this time. Dose, when you talk about dose dependence in men, it kind of goes a little bit with the sperm situation. So when we talk about sperm, so they had this study not too long ago. So just last year, 2019, a big old study came out. So years and years and years, we used to say that marijuana affected sperm count. So we went by that, all this time. And then last year they had this big study that came out that says, hey, we looked at all these men, we looked at all these semen analysis, and it actually potentially could increase sperm count. But it talks about that at a low dose. It doesn't go into details of what happens with a high dose or increased amount daily chronic use of marijuana. What does it do with sperm count there? Data with that goes to more along the lines of it potentially decreases the sperm count. When you think about sperm and marijuana, we talk about, besides sperm count, it affects it in other ways. And that's something that study did not really talk too much about. So sperm, we want them, this is how I think when I think about sperm. So men make about 1,500 sperm a second. So billions and billions of sperm over time. We have billions of sperm. The other thing is the sperm is real, real small. So 0.05 millimeters. So if you can think about that, it's super, super tiny. That sperm needs to travel about 6 inches to get to this, from the cervix all the way up to the fallopian tube. So that little sperm, it takes them about 30 minutes, maybe to an hour to get there. But what we know with patients that smoke marijuana, or male patients that smoke marijuana, the sperm are actually affected on the motility. So if we take out, even if you just take out the article or the new study that came out about count, we still know that it affects the motility and how it can move and fast move up to go fertilize that egg. So we want to go from the cervix to the fallopian tube to fertilize that egg. What happens is sometimes they swim in circles, or they kind of go here, they go there, instead of going where we want it to go. Or it might move really slow. So instead of taking 30 minutes to an hour to get there, it might take 4 hours to get there. The thing is, marijuana affects the ability of the sperm, to penetrate through that egg, or what we call, making the sperm become active. The ability of that sperm to kind of penetrate and get through to that egg is huge. So that's another thing that marijuana can do to sperm, is the motility and making it become active to kind of get into that egg to fertilize that egg. So that's one of the things that I get that question all the time. My husband just read this article that last year they said that it doesn't affect the sperm count, which I can't say that I disagree with. I think that it's a good article in some aspects, but you need to consider, it talks about the dosing, the small dose versus chronic use. It doesn't kind of go into detail. It doesn't talk much about the other effects that marijuana has on sperm. So those are things to think about. Going back to how long is the sperm, affected? I get that question a lot too. So sperm, remember we said, 1,500 sperm a day, 1,500 sperm a second. I'm sorry. All these sperm, they're stored for up to 70, 75 days. So these sperm that are affected by marijuana, the motility or the ability to become active, can be living for 70, 75 days. So you really want to be off marijuana for at least 70, 75 days to have potentially no stored sperm in there that have been affected by motility or the ability to become active over time. It was a long answer to that question.
That's good though, because I know that was a big question for some people, is how does it affect the men? Is it just a women's issue? And so it does.
It does. It affects them more than you think. And I that's one of the hardest parts, especially I find more so, Neil, with that article that came out, because the first thing you do, if you look up, a lot of the partners will look up sperm count in marijuana. Well, that's one of the newest articles that pop up right away is that one. So, my patients are always saying, well, my husband read this article. It says right here, I don't have any problem making sperm for us, but it's not necessarily making the sperm as much as it's more of its ability to swim where we need it to go, right? Versus going kind of in a circle here. And then when it gets up there, to be able to do the job that we want it to do.
Yeah, that's such an interesting point. It's not just about the count. It's about the effectiveness of the sperm that you have. Kind of reminds me of those articles on coffee and wine that come up every so often. Like, no, this is good for you.
Right.
Yeah. Did you have any thoughts on CBD as well? I think that came up. It's different, but same thing with the.
I have mixed feelings about it, because I think there just needs to be a whole lot more research on that, because all of them are made a little bit differently, or the production and the amount and how it's absorbed and how you cream versus, inhaler, all these different things, or foods and things like that. So I don't really have too much of an answer on that, as much as I feel like without knowing it too much about it or having more data on it, because there's so many various forms that you can get, I still would recommend no at this time.
And I know some might have some THC in them, even though they try not to. So there's that issue sometimes.
Exactly. Yeah.
I think that covers our questions. So is there anything else you'd like to leave our community with? Any thoughts, suggestions?
So I think when we talk about the fertility and, the sperm stuff or the ovulation, just keep those things in mind. Marijuana in pregnancy potentially can have long-term effects on the children later. Sperm, we would like to be free of marijuana for 75 days to give you the best potential to kind of get pregnant there. And technically there's nothing huge that says it's going to prevent a pregnancy, because we can get pregnant all the time, even with marijuana from what we see. It just, depending on your history and your background, might have a little bit of a delay there, but other things are probably affecting that versus the actual ovulation. And then I'm available for virtual consults if you need to. I've been doing those. I absolutely love them, kind of analyzing your period and your graphs and everything, and figuring out when's the best time, or some suggestions and things like that.
And you can find Amber right in the Premom app. I believe right now it's in the More section. If you go to schedule a consultation, you'll see different provider types come up, and you can find Amber right in the app and set it up within minutes. Pretty neat.
Awesome.
Yeah. Thank you so much for joining us today, Amber.
Yes, I'm glad we were able to do it. Thank you.
And thank you for watching, and we'll see you again soon.
Take care.